It is inspired by true events. A young lady in Abuja who happened to be a singer, because now we have to refer to her in the past, passed on from an alleged snake bite. Her crew, those who she sings with, claimed that the medical facility did not have antivenom to treat her. That medical facility, which is the FMC in Abuja, put out a statement defending its actions and saying that they provided immediate and comprehensive care. Treatment included resuscitation, intravenous fluids, intranasal oxygen, and administration of antivenom. Now, my guest is Professor Kingsley E. Douglas, public health physician, and he's telling us all that we need on this subject. You're welcome once again, Prof.
Thank you very much.
All right. So before the break, you were giving us preventive measures.
Yeah, because 90% of the treatment for snake bite is prevention. So what we're saying is, you find places where there is no clutter and all that in homes, try to clear this clutter so that as you are chasing away all the rats, they just know that wherever there are rats, snakes are likely to come close to that place. So you make sure you don't have too much of clutter, especially around your environment.
Yeah.
Cut the grass, the bush, and all that. You know, they say snake in the grass. Nigerians like to say big snake in green grass. It's actually snake in the grass.
Yeah.
So you get that done. Then the moment that is done, you start the stake of food. So you have to look for somewhere else for food. Fumigation cannot be overemphasized. You know, Nigerians have not imbibed fumigation.
Yeah.
Fumigation is the way to go now because we are gradually migrating from metro cosmopolitan city, and these things find their way to our homes. And for a domestic home, between 120 and 80 days, at least every 180 days, you should be able to fumigate the house for insects and rodents, and of course, snakes and all that.
Reptiles.
Now, having said this but in the event that there is a bite, this is where this is important. Please make sure you don't, because the idea is that when there's a bite, people will run and start chasing the snake. Allow the snake to go. Make sure the place is safe. Relax the patient. Relax the person. Calm the person down. Snake bite is not nice thing.
Prof, sorry to interrupt you.
Yes.
You know, one of the reasons why they catch the snake immediately is let you know go and bite another person. You understand?
If you know, the snake is one of the most, I will tell you, the snakes hardly fight two wars at the same time. The moment they have one war, they look for a way to escape. So allow the snake to escape and start looking for it later. I believe one life is actually more than a million snakes. One human life, I mean. So you relax the person, lie the person down, and the person should lie towards the left-hand side. Don't forget, the snake is neurotoxic. It affects the nerves. All it's trying to do is stop the person from breathing. The constrictors, like the anacondas, there's constrictors, all they go for is the chest to make sure that there is reduced air in the lungs and the person will suffocate and die. That's the same way the neurotoxins work. They paralyze the respiratory system and the person goes from there. So, person is stay down quietly and calm, reassured, lies to the side. Please don't try to suck out the venom. There is this myth about sucking out. Don't try to suck out the venom. Second, do not increase the size of the area of injection where the fangs must have found its way. Leave the size as it is. There are debates as to whether you need to wash it or not. Washing it doesn't add anything. The reason being that it's an injection attack. So what is on the skin, they are best just cause some minor urticaria rash. And that's not important. So the most important thing is, first, reassure the patient, make sure that he's away from where the venom is. Do not puncture. Do not try to suck it out. Do not also try to increase the size of the wound. Now, compression. Don't tourniquet. Tourniquet means do not tie above the point of. There's this myth about tying above the point of bite. Rather, start from the end below the bite. Use a shirt, use a singlet, use anything you can find around that's like a cloth. Tie with compression. Tie with compression. Tie with compression till you cover where the wound is, so that, don't forget, it's an injection injury. You might also expose the person to tetanus. So you tie with compression slightly above, at least we're talking about 5 to 7 cm above where the bite has taken place. Compression. Tying with compression. And it's different from tying with the tourniquet. Tying the tourniquet is to completely occlude blood supply. Now that compression slows down, but still supplies blood to the leg, but slows down return of blood back to the heart. The moment you do that, also add a stick. Use a stick as more like this to stabilize the area. We call it in when there's a fracture, you put it's like a sling. Use a stick to straighten that part of where that thing is, so that blood flow is symmetrical. It's just going slowly back to the heart, but going slowly but surely. At that point, the person is lying to the left, you carry and move straight to the nearest health facility. Straight to the nearest health facility. Then we take it up from there. They are the health facility. The most important thing is to make sure airway is there. Assess antivenom, airway is there. Take care of infection. Snake bites are usually not very, very painful. It's a thing that just stops and take care of infection, and then go where the wound is and take care of it. But a few things I also need to tell you.
Very
Some
quickly.
people tell you that if they cut Bitacola and put here and there and all that the Bitacola will chase away snake. In fact, what should even chase away snake are things like snake doesn't like the smell of garlic. Snake doesn't like the smell of onion. But don't forget, garlic has a very short half-life, which means if you cut it open, you keep it, give it another maximum 20-30 minutes, it will not, it may lose
Its potency.
that smell that drives it away.
Yeah.
So, but if you have onion at home, you have garlic at home, and it's there, it's not that it stops it, but it has more like an effect in making sure they don't come close.
Yeah.
But the myth about Bitacola and all that. So, and there's also the myth that if you kill a snake, you put it in a bottle and you hang it around, that snake will not come around there. It's not true. Snake will go wherever it wants to go to. It's not true. It will go to wherever it wants to. But let us also understand something.
Yeah.
The reason why we also discourage people from just washing off that venom is that the venom helps the doctor or the attending physician to know whether this is a venomous or non-venomous, or the type of snake that must have bitten the person. It may be also helpful if the person who has been bitten to tell us the color of the snake, because colors help. The darker the snake, the more venomous it's likely to be.
Okay.
Of course, if it's a cobra, you know where we are going. And all that. But generally, the green type snakes are not